Amanda, thank you for joining me today.
Of course. Thanks for having me.
Yeah, absolutely. I want to start off by asking just what is Angelman syndrome?
It's a good question. It's something that I definitely didn't know until it came into my life. But Angelman syndrome is basically a deletion or mutation of some sort on the 15th chromosome, which causes the UBE3A protein, which is within it, to not be produced. So because of that, a lot of our individuals who are diagnosed with Angelman syndrome tend to have really severe developmental delays, severe seizures. They have a lack of speech. So most of our individuals speak with a communication device or signage, signing of some sort that they've created. They have motor balance issues, and they also have a really, really hard time sleeping. But they are filled with so much joy. And, it's interesting that it's called Angelman because one of the characteristics is that they tend to be a very, very happy individual, despite all of the adversity that comes against them.
And if I read correctly, the history of kind of how Angelman syndrome was discovered was almost off of that joyous basis, right?
Yeah. So, I mean, it's interesting because the first case that was kind of reported was from Harry Angelman, and it was forever ago. And it was one person internationally, one of his patients that he found, in that he wrote this article about all of these characteristics about this person, and they actually called it the happy puppet syndrome because of, one, the happiness, but also kind of their balance disorder, the way that they kind of move and they flap their hands reminded him of a puppet. And so fast forward many years, there was a geneticist at a university in Florida, Dr. Charlie Williams, who came across a patient that kind of had some of the similar characteristics. And so he reached out to Harry Angelman, who had done a paper on one patient, and said, hey, I think that I have a patient that is, displaying a lot of these characteristics. So they had a conversation, and then kind of, the birth of Angelman syndrome started from there. They started seeing and recognizing these characteristics in more individuals. They started diagnosing more. Back then, a lot of our individuals were clinically diagnosed until like genetic testing came around and they could get a genetic testing. But then luckily, Dr. Charlie Williams said, hey, Harry Angelman, you wrote the first paper on this. You've been really passionate about this. I think we need to rename this from the happy puppet syndrome to Angelman syndrome. So that's kind of how that came about.
Wow. And how did Amanda come to know the Angelman world?
Well, I think like a lot of other people, it impacted me personally. My husband and I, as we started, wanting to start a family, we tried on our own for quite some time, and it just wasn't happening. So we went the route of adoption, and were able to meet our birth mother, who was luckily pregnant with twins. And so we met her at 6 months old, when she was 6 months along with the boys. So we were in the delivery room with her, and got to be with the boys as soon as they came into this world. And, right off the bat, there was nothing wrong with either one of them. They had a very healthy birth. We were at home after 48 hours. Both of them had feeding issues and some GERD issues, but for twins, that's typical. But what we started seeing, 4 months, we started seeing Jackson wasn't developing as quick or doing some of the same things that Baden was doing. And so that was the first time we kind of went to the doctor and said, hey, something's going on here. We're a little worried. And, it was the first time we heard a doctor say, well, let's just sit and wait. Right. I mean, we heard that a lot. Let's just wait. He's a twin. He's going to develop maybe differently. Twins sometimes, are slower to gain those milestones. And the gap between Jackson and Baden just kept growing. And, so the first sign really was the developmental delay. But now looking back, a lot of our individuals with Angelman syndrome, the first sign is feeding issues. But we didn't know, right? We had no sense of understanding. And so When Jackson went, there was a lot of testing. Everything outside of genetic testing was done to find out what was going on with Jackson. They kept saying, we think it's autism. It could be cerebral palsy, but let's just wait and see. And around 18, 19 months, he was crawling and he kept falling over, and we thought something was going on, maybe an ear infection. So we took him to urgent care. And as soon as the doctor walked in at urgent care, he said, does your son have epilepsy? And I'm like, no. And he's like, well, your son's having a seizure right now. And, all I knew of seizures back then was, the violent shaking and the foaming of the mouth. I didn't know anything different because it wasn't a part of my lens growing up. I didn't know anyone who had any sort of an epileptic disorder. And Jackson's eyes were just fluttering, and we thought he was just tired because he never slept. So we rushed him to the children's hospital, and he was having, seizure after seizure, second after second, just seizures. And finally, at that point, we had a young doctor who was in his fellowship at Riley, and he looked at the EEG and said, this EEG pattern looks really familiar to a rare disease I studied in med school. It was like a paragraph chapter in his med school book, and he remembered it. And he's like, I think we need to test for Angelman syndrome. So that's the first time we heard the words Angelman syndrome, was in that hospital room. After months and months and months of begging for answers, to something. And so that was the first time we heard Angelman. And then, for me, the way I coped with that diagnosis was I reached out to the Angelman Syndrome Foundation and said, what can I do? I want to provide the best life for Jackson, whether that's finding a treatment for him, whether that's, understanding everything I need to know about Angelman syndrome so I can be prepared. And so I joined their board a week after diagnosis, and really started at that point kind of the crusade in my mind of like doing everything I can to, better the lives of those living with Angelman syndrome. Now fast forward 8 years, I've been the CEO of the foundation for almost 7 years now. So I like to tell people very often that I think it was divine intervention that Angelman was brought into our lives. We always, as a community, kind of joke and say, like, no one wants Angelman syndrome, but how blessed we are that we've come into a community of such amazing warriors and advocates. And really none of us, I think, could survive without each other.
Wow. Well, that is an incredible story. That has, I can't believe there's so many pieces to.
I know. I'm sorry. I should have stopped in the middle.
No, there's so many pieces to untangle. I mean, the from the adoption process to, that is a whole thing for most people in and of itself. And then to have that wonder, I guess the question that I want to ask is, was the diagnosis of Angelman syndrome, did it bring you peace because you finally had an answer? Or, did it just leave you with more questions?
I mean, I think it's so interesting because I do think a lot of families will tell you that there was finally a relief of we have an answer, but it's mixed in these emotions of like, you're grieving the life of the child you thought, the life that you thought that child would have. You're grieving the life that you as a parent envisioned for yourself. There's so many things that happen in that moment where they say, right? And with genetic testing, it's not just like that. The doctors told us, we think this is what it is. And then we had to wait, 5 or 6 weeks to get the testing back. And in those 5 or 6 weeks, there's a lot of bargaining going on in our head. With me, it was bargaining with God. Like, don't make it be this and I'll do this. Like, you're praying that it's not that, right? But, when the doctor actually called my husband. And so my husband came home from work and he took me upstairs, and he had asked my mom to come over. So my mom was downstairs with the twins, and he just, I kind of knew in my heart, like once someone says it's Angelman, like the doctor said, don't go Google it, go to the Angelman Syndrome Foundation, because Googling it will send you down a spiral. So I did. And once you start reading the symptoms, you're like, well, of course that's what it is. Like there was no way that's what it was not going to be, but there's still that part that grieves, right? And so I think that, yes, there was a piece of like, we have an answer. We now have a plan on how we can help and support him because we have a diagnosis. But mixed in all of that is this extreme grief that if you let it, it will completely take you over. And I think the way I coped with that grief was I had to get involved. Like I had to jump in and I had to do something, or that grief would have sent me into a massive spiral.
Yeah. You mentioned the doctors asking you not to Google it and to go to Angelman Syndrome Foundation specifically. I've read that there's a lot of misconceptions around Angelman syndrome. Is that accurate?
Yeah, I mean, I think it's gotten so much better online, but the doctor actually, not the resident that first saw us and thought that's what it was. The doctor, when we met with him, the geneticist, said that Jackson wouldn't walk, he wouldn't talk. He would, have to have our care for the rest of his life, that he wouldn't have the ability to show emotion or love, like all these things that he wouldn't do. And so that's initially what is put in your mind. And when you do that, like now looking back on it, if I would have believed that, if I would have said, the doctor said he will never do this, so I'm not going to even try. I mean, who knows where Jackson would be, because Jackson's walking. Jackson's talking in his own way. It doesn't look the way everyone thinks talking should look, but it looks the way for him, and it's the way he communicates. He is feeding himself. He is almost potty trained. And I will tell you what, I don't know anyone in the world that I've ever met that shows love immensely like he and all of his buddies with Angelman do. They show love with no bias, no expectation, full of joy, no fear. It's just a love that if all of us humans could actually have, this world would be a much better place. So yes, the initial thought of all the things that he wouldn't do was terrifying. I do think it's gotten better. I mean, we've only been diagnosed for 8 years now. And so that's a huge gap of time and a lot of understanding that we have found. But can you imagine people who were diagnosed 15, 20 plus years ago? I mean, it was much more, even more doom and gloom, right? So we're getting better, but it's still, there's still a lot of all the things your child won't do.
And so that would put Jackson at around 9, is that correct?
He's 10. He just turned 10. Yeah. So yeah.
Would you say for his circumstances, like you said, all of his progress that he's made, would you say that is kind of the average case that you're seeing now, or is he kind of ahead of the curve? Or
it's such a good question. New families, when they call me, they always ask me the question, when will my child walk? When will my child talk? When will my child hit these milestones that, we see on social media or we see families doing? And, Angelman syndrome is a very, very diverse disease. So it's really, really hard for me to say your child will walk at this age. I mean, we can say that there's a percentage of children that do things at specific age groups, but there's a lot that goes into that, those things happening. And it can be anything from, just simply having the education and the standards of care on how to treat Angelman. It can be literally the access that you have. It can be even the where you are as far as in the country is, if you are in a rural area and you don't have access to therapies or knowledge, there is so many components that go into our children being able, or our individuals with Angelman syndrome being able to be successful. And that's something that we really try hard to work on at the foundation, because in my opinion, everyone should have access to all the things that their individual needs to, to really thrive. But sadly, that's just not how the world works. And it's not how insurance works. And it's not how hospital systems work. And, as much as I could take one child and put them up to Jackson, same age, same, deletion positive diagnosis, I'm privileged and I can get Jackson therapies and access to things. This family may not have the same privilege. So their child may not be where Jackson is. And some of them, part of Angelman also is that there's 4 different genotypes, deletion positive being 70% of the kiddos. So the other genotypes, it could be more severe or it could be more advanced. So it's really, really hard to kind of put an overall blanket statement on when kiddos will do anything. But I tell families all the time, don't underestimate your loved one with Angelman syndrome. They are smarter, they are stronger, they're more resilient than anyone ever gives them credit for. Like, there are so many times where Jackson does something like a typical 10-year-old kid does that drives me like his twin. And I'm like, inside, I'm like, what you're doing. What you're doing is wrong. And he's acting like a typical 10-year-old. And like, even though we were told he wouldn't have that, developmental mentality of a 10-year-old, he's in there and he is smart. And I think sometimes we just don't give him that credit, right? So I tell people, don't underestimate them. They will surprise us at every turn.
I love that. That's beautiful.
Yeah.
Now, you mentioned, going back to the diagnosis, that you hadn't heard about Angelman syndrome before Jackson's diagnosis. How common is Angelman syndrome in the world?
So right now, what we have is the prevalence is about 1 in 15,000 live births. So if you take the US population, there should be, close to 24,000 individuals with Angelman syndrome in the US, over 500,000 in the world. There's a lot of things that go to that number, or to that number either getting bigger or smaller, because now that we're seeing better access to genetic testing, now that we're seeing a better understanding of rare diseases, I envision that number possibly, maybe moving to 1 in 10,000. I mean, we're seeing kind of a very much quickening of diagnoses of Angelman syndrome. And we have families, like I said earlier, that were diagnosed, got a clinical diagnosis, 50, 60 years ago, that now are getting tested and either have the genetic testing results of Angelman, or they find out it's something completely different. There's 7,000 rare diseases in the world. There are a lot that present like Angelman syndrome. And so I think that we'll see a change in that, but it all goes, in my opinion, to getting access to that genetic testing. And in the US, we're better, but think about internationally. Think about places around the world that, don't even have access to healthcare, right? My suspicion is there are a lot of people out there who have loved ones who just simply have not gotten a diagnosis at all.
Right. So you mentioned the genetic testing often for the diagnosis. Is that the only form of testing that you can do to diagnose Angelman syndrome?
Yep. Since it's a genetic disorder, you have to, it has to be genetic testing. I mean, obviously you can clinically diagnose it. And if people are okay with the doctor saying clinically, I think that's what it is. But, moving forward, as we are now into some trials for treatments, you're going to have a genetic test to say that, this person has Angelman syndrome, because obviously they're not going to, if we get a drug approved, they're not going to give a drug to someone who has a clinical diagnosis. And so genetic testing is crucial. And honestly, I do think every family wants that answer and they deserve it. So getting access to it is incredibly important. And for some reason, it's gotten better. But for some reason, it always seems to be the last step after all. We had MRIs, we had EEGs, we had EKGs, we had every test that cost a lot of money outside of genetic testing. And all we needed was that one blood prick, right? I mean, so it makes it really, really frustrating when people don't get access to that.
So you talk a lot about the struggle to get access. I know the Angelman Syndrome Foundation has several clinics out there. if somebody can get access to a clinic, what does a clinic offer?
So most of our clinics, we have about 35 in the US, are multidisciplinary clinics. So this means that when a family signs up for an appointment, they're going to come on a day. Their day is probably going to be 2 to 3 hours long, but they're going to see all the necessary Angelman expert specialists. So they may see a geneticist if they still have questions about their genetic testing or if they haven't gotten it right. They'll see a neurologist to talk about seizures. They'll maybe see a sleep doctor to talk about the lack of sleep. They'll see maybe a GI specialist because our kiddos suffer from, really debilitating GERD and constipation. That is a big issue for them. They may meet with PT, OT, and speech. And so they're getting all the specialists within one visit. And these doctors have been, deemed from the Angelman Syndrome Foundation as, experts or knowledgeable within the Angelman syndrome. And that's really important because a lot of times, even early on in our diagnosis, every time I went to a doctor, I was telling them how to treat Angelman syndrome, right? Or I was printing off things from the Angelman Syndrome Foundation website that these clinicians had developed and saying, this is how you treat Angelman syndrome. And I just want to be a mom, right? I don't want to be the doctor. I don't want to be telling them how to treat. So when you go to one of those appointments, you sit with people who allow you to be the mom. They tell you how good of a job you're doing. They tell you how good your child's doing. And then they give you a plan and they give you support on multiple areas. So you leave feeling like you've been heard, you've been seen, and that your child is going to get the care that they need. And we had always planned that these clinics would be, our goal has always been care. How do we care? But now these clinics are evolving into not only the clinical care, but they're now acting as clinical trial sites. And so, trials are happening for a possible treatment for Angelman within these clinics that we started building 15, 20 years ago. And so it's a beautiful model that came way before my time, so I can't take credit for it. But I think that the families are incredibly lucky because there's not a lot of specialty clinics for rare diseases around the U.S. And the fact that we have 30 for such a small rare disease, I think is quite remarkable.
That is amazing. Now, on the cost, is there insurance usually covered for these clinics? Is there grants that are out there or anything like that?
Yeah, typically insurance will cover the visits. If they don't, we do have something called the Family Fund. We do the Angelman Syndrome Foundation Family Fund twice a year. And actually that fund was created to allow families to get access to the clinics that they want. So if you need to travel, our goal was always that the clinics were within driving distance of all of our families. And we're still working on that. But if you have to travel, stay overnight, you can apply for a grant for that. And the Family Fund has turned into something much bigger than that. What we also found was because of insurance, Medicaid, and basically a system that was not made for kiddos like ours, our families have to fight for stuff that really is needed to improve the quality of life of their loved ones. So safety beds, adaptive bicycles, strollers, adaptive toileting, all these things that are denied by insurance in some states. People can now apply, through the Family Fund to receive that as well. We have people apply for communication devices. But we do this grant twice every year. It started in 2019, and I think we have already gifted close to 480 families funds. And part of that is getting them to a clinic if they need to. So if you want to get to, I always tell families, if you want to get to a clinic, we will make it happen no matter what.
That's amazing. So you've got clinics through ASF, and you've got this family fund as well. What else does the Angelman Syndrome Foundation do for families?
So outside of the Family Fund, when it comes to family support, I tell families all the time, if there's something that you need in your day-to-day journey, I guarantee you we have support in some way. So we do a lot of consultation. So families that need support with IEPs, with behavior issues, all these different things, they can sign up and get a one-on-one consultation with an expert. from the comfort of their home. One thing we started during COVID, which is probably the thing I am most proud of, is that we found that our caregivers were suffering, their mental health was suffering. And I also think caregivers and siblings always get left in the dust when we talk about a loved one with any sort of diverse need, right? You always concentrate on that person. And when the family unit is not strong, when the caregiver is suffering, when the siblings feel like they're left out, it all crumbles. And so we started a mental health program to where at any time, they can reach out to our counselor that is basically full time with us now, and they can get free counseling. And so our counselor has probably seen over 1,000 families by this point. It could be a mom, it can be a dad, it can be a sibling, it can be an uncle, it can be an aunt, a grandma, a grandpa, a newly diagnosed person struggling, someone who just lost their child with Angelman, into an unspeakable death, that they're there on call and to support in any other way. We have our family conference every other year, which our family conference is this year in 2026. So we're excited. And then, outside of the clinics and family support, we've been supporting research for 31 years. And so our goal with research has always been from the beginning to understand Angelman. Like, how do we understand what UBE3A is, how it affects the development, how it affects the brain. And so we've funded close to $18 million of research to help us get to where we are today, which is we're in clinical trials with the main goal of being, how do you activate that paternal gene? Because with the maternal gene, if it's deleted, if it's mutated or whatever, the paternal gene is still silent because it's still activated, but it's not producing that UBE3A. If we can activate the paternal gene to produce that UBE3A, we think we could see rescue. So, we've really, really focused hard on how we support research, but also I think the ASF is a very holistic organization, right? How do we support you from the time your diagnosis throughout your journey of Angelman in some sort of way? We have something for you here.
That's amazing. And you talk about a couple different types of Angelman syndrome. How many types are there?
So there's 4 different genotypes. And this is where the geneticists of the world would be able to explain much better than I can. But, deletion positive, like I said, being the largest one, it being, about 70%. And then we have something called UPD, ICD, and mutation. So those are just 3. They're smaller pockets of the community, anywhere from 3% to I think like 11 or 12%, based on those 3. And they just display differently. And so, they either have a mutation or something else going on in that way. And so right now, when it comes to looking at Angelman and the treatment of Angelman, most of the companies have really focused on that deletion positive, because with the other ones, we don't know if we add UBE3A in, if we would overexpress and put too much back in, right? And so there's still some research being done on that. But the good news is that a lot of the companies that are in trials right now are starting to add those other genotypes into the trials to see. And so, the hope is if a treatment gets past the finish line, that it would be a treatment for anyone who is diagnosed living with Angelman syndrome, and then dealing with the uphill battle of getting access to that treatment for everyone, because these aren't, over the counter Tylenol that you pop. These are, really invasive, and the current drugs that are in trial they would have to get a lumbar puncture injection every 3 to 4 months for the rest of their lives. And so you're talking, really expensive, both financially, but also mentally and physically on everyone. And so there's a lot of things that we're thinking about as a community and organization as we get closer. But I would say, if, even though all of that is super scary, the fact that we even have any sort of treatments within trial is a milestone and gives so much hope to the community.
So you mentioned the lumbar puncture treatment. Is that the most common form of treatment, or what are the treatments for Angelman syndrome?
So right now the treatments are symptomatic. So if you have a seizure, there's seizure medication. So it could be a pill or a liquid. If you have GI issues, there's Miralax or other ways that they do, so it's all symptomatic drugs that are already on the market. So some families, especially older individuals with Angelman syndrome, some of them are on 6 to 7 different seizure meds to control seizures. And so, for Jackson right now, he's on 2 seizure meds. And then he gets melatonin at night. We're really trying to keep the medication amount down if we can. But if a treatment comes, we don't know if we will be able to stop all those other drugs. The hope would be that would be the case. But this would be obviously a way more invasive, because all those other, symptomatic drugs are mostly oral pill forms, right? And they're easy over the counter to get for the most part with a prescription. Medicaid typically will cover it. And this will be a fight to get insurance to cover the cost of this. And then it will, it's a procedure that you would have to go in every, whatever the industry deem the amount of time that you have to have this. They would have to go under. So you would have to have an anesthesiologist, and you'd have to have someone who could do the lumbar puncture for the drug. And so it's a lot more expensive and invasive of a treatment than the symptomatic ones.
Yeah, we can see that. If you have a history of Angelman syndrome in your family, does that increase the risk of it being passed down?
So most percentage of people who have Angelman syndrome, it's unfortunately just, I hate to say the luck of the draw, but it's just something that happens within the genetics. There is a small percentage of our community that it is genetic. So if they have multiple kiddos with Angelman syndrome. And so, it's a small percent of the community, but this is something that every, parent will ask me when they're thinking about having another child, is like, is this something that they could have? And the answer is we just don't know unless mom and dad go get genetic testing themselves to see if there is a marker for that. And so the answer is yes, it can be passed down. There could be multiple, kiddos with Angelman syndrome, but it's incredibly rare.
And what do you believe the likelihood of a cure for Angelman syndrome is?
I think you're the first person who's ever asked me that question directly, ever. Because I do believe in a cure, 100%. I think what's happening with science right now, what's happening with the technology, with the amount of resources that the organizations that are in this community have put towards understanding Angelman, treating Angelman, and trying to cure Angelman, I am convinced that yes, there will eventually be a cure. What does that look like? I don't know. When does it have to be administered? I don't know. Will Jackson be cured of Angelman now? Someone gave me an analogy once of, when I first got into this world, keep in mind, I am a liberal arts major. So before I was doing this work, I was working at the YMCA, right? And so when I started this job, one of the hesitations was coming onto this job was, one, I have no medical background. I have no science background. And even worse, I don't have the brain for either one of them, right? And so, but I've learned a lot, and I've surrounded myself with phenomenal people that do. But when I asked about this once of like, when you talk about a cure for like Jackson, what does that even look like? And he made the comment, he's like, the most simplest way I can put that is, he's like, you wear glasses, right? And I'm like, yeah. He's like, now, if you take your glasses off, can you see? And I'm like, not really. I'm kind of blind. But when you put it back on, you can see, right? And I said, yeah, right. Yeah, for sure. And he's like, you're not cured of the fact that you can't see. You have a treatment now that allows you to see with glasses. And so not understanding the mechanics of it all and how this all works, like, I think there'll be a treatment that will radically change the quality of life for Jackson 100%. And, I try to be very careful on when I speak with parents, when I even speak in my own mind and think about managing the expectation and the thoughts of what I think Jackson's life is going to be like, and what I hope all of us, what we hope we do find. I remained very optimistic and hopeful, but know that I still have to plan for the not, right? I still have to plan that Jackson will need our care for the rest of his life. I still have to plan for when I'm gone, who is going to make sure Jackson's safe and loved on. Like, there's still things that we need to do with the hope that that's going to come.
To close it out, what do you want people to know about Angelman syndrome? Is there anything else research-wise, trials-wise, or just even if it's a little bit more of the joy that your son Jackson has in living life with an Angelman syndrome diagnosis?
I think I always like to leave with the joy, because I tell families, newly diagnosed families, I have far more amazing, wonderful, and better days with Jackson than I have bad. But the bad can be debilitating, right? The bad can be an epic seizure that sends us to a spiral. The bad can be vomiting that won't stop. The bad can be a behavior because he can't communicate, and it can send you into, or you haven't slept for years, right? Can send you into a spiral. But when I sit back at night and I look at Jackson, I would never wish Angelman upon anyone. But my gosh, when I think about a treatment and what it may do, the one thing I think all the time is, please do not take the love and the joy that he has for others in life away from him. Because the world now, and the world that he's living in and may be living in, we have to fight for people to see value in individuals like Jackson. We have to fight for services. We have to fight for everything when it comes to giving Jackson and kiddos like Jackson the things that they deserve and have rights to. And, I want that to go away. But the fact that he smiles through it all, and that he teaches all of us the importance of inclusion and equity without even knowing what that even means. If everyone could see through the world like Jackson and his buddies, I keep saying humanity would be so much different now. And so all I can do at night is sit back and pray that he gets all that he deserves in life, whether that's a treatment, whether that's resource, whatever it may be. But I also think, what have I learned from him today? And what has he taught me about the value of being just a decent, good human? And our lives would not be the same without Jackson and without Angelman syndrome. Like, once again, don't wish it upon anyone, but my gosh, the love and the joy that he brings to all of our lives, it's really, really hard to put in words. But I would leave everyone by saying, there are far more better days than there are bad days. And your child will teach you lessons that you never thought you maybe needed, or you never thought that they would do, like they would teach you. They're unbelievably resilient, amazing humans.
That is incredibly beautiful, Amanda. Where can more people learn about Angelman Syndrome Foundation?
Well, they can go to angelman.org, super, super easy. They can go to we have a Facebook page. Hopefully we're going to have a new kind of community through this awesome new platform with you all. And then we have a podcast as well that you can find, the Angelman Syndrome podcast, which we'll hopefully be sharing this podcast on there as well. But you can find us anywhere, and don't hesitate to reach out. We're always here to support you no matter what.
That's beautiful. Thank you for joining me, Amanda.
Of course. Thank you.